Time now for our Facts Not Fear coverage of COVID-19. The CDC now recommends Americans choose either the Pfizer or Moderna COVID-19 vaccines. That's over Johnson & Johnson's. This decision stems from a rare health complication seen in a small number of J&J recipients. 10 TV's Richard Solomon spoke with a local health expert on what this means for people who did get the J&J shot and what's next.
A lot has changed in a year, from not having vaccines to now having 3. And for Amy Stadoulis, it's the difference between missing out and making memories.
Today our son graduated from the University of Dayton, and we were able to have a ceremony, and our daughter last year graduated the same day, and they weren't able to have a ceremony.
But the latest change comes from top health officials. A panel of CDC advisors recommended getting Pfizer's or Moderna's 2-dose vaccines over the Johnson & Johnson's 1. Stadoulis is fully vaccinated, and hearing the news, she's thankful she got Moderna.
Absolutely.
The reason the CDC says you shouldn't get J&J now is because of the rare but deadly blood clots that are linked to the J&J vaccine.
I think it also brings up the question for people who did get the J&J vaccine. What does that mean for them? What are they supposed to do next?
So if anybody has received the J&J vaccine, based on real-world data, they should get a booster.
Dr. Joseph Castaldo with Ohio Health says the J&J vaccine has not been removed from the market. In 17 million doses that have been given, 54 cases have been reported of the rare blood clot. And out of that, 9 deaths.
Based on data and based on science, things change, and we have to be very open and transparent with people. We don't know what's going to happen in the future. We need to continue as is.
More changes are likely to happen, but the best way to protect yourself is to simply
Get vaccinated.
In Columbus, Richard Solomon, 10 TV News.
And Dr. Castaldo says for anyone who doesn't want to get a 2-dose vaccine, or if those aren't available, the J&J vaccine should be made available.